I wonder if we accept insurance, how can we justify fee difference from cash pay rates? Do we make difference of insurance pay and cash as well as co-payments? I'm not sure I understand. Yasmin, are you, and I know we talked about this before, you're accepting insurance and you're also billing cash with MPI 1 versus MPI 2, or what's your current situation?
Like I was thinking to accept insurance and cash patients at the same time, but the fees will be different because the different insurance pay different rates. And
Okay.
then cash rate is going to be a fixed rate and can be different from what insurance pay. So that's that's not going to be equal for every patient.
Just so I understand, what would be the reason you want to accept insurance and cash versus just cash?
I guess like I want to build the caseload by
Okay.
accepting insurance in the beginning.
And then maybe transition them in the future to cash, potentially.
Yes.
Okay. And are you going to be doing this via like Headway or Alma for insurance?
Headway or Alma, yes.
Got it. Okay. So the way that you do it, first of all, if I'm understanding the question, when you say like justify, do you mean justify internally to ourselves or justify to the patients?
Like to the patient.
Okay. The answer is that you shouldn't advertise that you accept insurance. If you're working with, say, Headway or Alma, you're just listed on Headway and Alma sites, and then that's how you're getting insurance patients, or patients are finding you through contacting their insurance company and seeing you're listed. That's the only way you're getting patients. Your website should solely be advertising your cash practice. So it shouldn't seem like, oh, you have two options, pay cash or bill insurance. Of course, why would anyone want to pay cash? And the truth is, under an insurance practice, you just don't have as much time with patients. You really can't, even if you're the same person, it's hard to offer the same level of care. So with an insurance practice, like with Headway or Alma, you'd just be seeing more like bread and butter patients just doing med management. There's not really anything else you can do in those appointments for the most part. Whereas in the cash practice, you're doing potentially psychotherapy, along with the medication management, along with holistic complementary approaches, discussing lifestyle modifications. You're just able to offer a lot more. What I would more often recommend is, if the issue is you need income and you want some side income as you're building a practice, just get a moonlighting job 1 to 3 days a week. Otherwise, you're essentially building two practices at once, and it's going to divert your mental focus and energy. It would make a lot more sense if you're worried about getting patients in the beginning, as opposed to accepting insurance, just charge less. You will get more patients. So whatever you'd get billed by insurance or reimbursement from insurance, just charge that in cash. And that's not going to be too crazy for patients to pay. You'll fill your practice with patients faster. Maybe then you increase your fees in the future. And maybe you even tell them, this is an introductory rate because I'm starting my practice. It's good for 6 months or whatever period of time you want to say. To me, that would make more sense than full on billing insurance. But think it through, and then, we can discuss it on future calls too. Okay, let me get to Ben's question, who had a question about screening, or like mentioning fees, like when to mention them, how to discuss them on that initial call. I recommend, either patients will already know your fees because they saw them on your website, or if you don't list them on your website, you just say your fees, and then you don't say anything else, you don't explain, and you just see what they say next. And generally, this doesn't have to be hard and fast, but the reason is that generally if we explain more, it's from a place of anxiety and like over-explaining. So Ben, I'm curious, did this come up on a call? Is there a particular situation you have in mind?
As you're aware, I was leaving my other practice and bringing patients over with me.
Right.
So I knew how much they were paying already in terms of their co-pays. And so my pitch was a little bit different than if someone's just cold calling me and setting up an initial screening call. So I was kind of in that mindset. and explaining to people, it would be more, but here's what I would have to offer versus staying in network. And there's some things that we can do to help, like giving a super bill, or next year using flexible spending and spacing out appointments. I might have explained some of those things. So I was just reflexively probably going to explain that out of a place from anxiety. I kind of recognized that, but I guess I wanted to understand the psychology, the marketing aspect of just like saying it and shutting up and right.
So actually, your situation is a little bit different because you know exactly what these patients were paying before and what their expectation was. So I think doing it the way you described makes sense. And whether that's in a letter you write them when you say announce the practice and your fees, or if it's in like a one-on-one conversation, I do think saying like, oh yeah, my fees are X. I understand this might be a transition for you given that you were used to paying via insurance when we have been working together, but here are the extra benefits you would get, XYZ, and I'd be able to provide you super bill, and like exactly how you explained it. Generally, the reason I say don't do that is because it's usually based on a projection about assuming what the patient is thinking. In that case, you actually know what the patient's probably thinking. Someone who's just calling you randomly from the street, we all get the anxiety in our head the first time we say our fees, but then everyone who's said your fees, we've all had that experience of someone just saying, oh, okay, sounds good, and not reacting, being totally fine with it. So I try to just help people not over-explain when they're just gonna get a, yeah, okay, that's fine. Because if you start over-explaining to a patient who would have just said, yeah, that's fine, it almost like diminishes your value in their eyes. Like, wait, why is this person over-explaining? Don't they earn that by being good? Like, that's why I'm happy to pay it. So you almost don't want to explain till you hear an actual objection, for when it's someone who's you haven't talked to before, don't know before, or don't know otherwise. Okay, Asia put a question. What do you say when someone says that cash pay private practices are unethical? It's unethical to cherry pick patients. I mean, I would say we can respectfully agree to disagree. Just out of curiosity, did someone say this to you recently, or?
Yeah, recently I actually spoke with a psychiatry fellow, and she mentioned that she does not think that it's ethical to either go into private practice and have a self-pay practice.
I mean, here's what I would say. If this person's just being rude, I wouldn't say anything, probably be like, I don't want to deal with you. But if it's like an actual conversation, I mean, what I would say is, look, we need all types of providers. People like me fill a void. We fulfill a need that the conventional psychiatric world doesn't. If someone could get what I provide with insurance, they would, but they can't. I take on patients that other doctors often don't want to see, and like complex patients that other people can't help, and I help them get better. So should every single psychiatrist charge cash and be in private practice? No, but that's not what we're talking about here. We're talking about, is it okay if some are? Not only do I think is it okay, I think that it fulfills an important need, and that's why people are willing to pay for it. Because I'm like someone who's a fellow, like hasn't even practiced yet. They heard that from an attending or something like that. That person hasn't lived in the real world and saw real patients really be let down by the system through no fault of the individual. I don't think it's the individual's fault, but it's a system where like, yeah, I'm taught that if I can't diagnose you with something, I can't treat you, or that, I just go through this checklist and then if there's nothing else, then goodbye. And sometimes I just feel like there's no humility in medicine. I wish we studied the history of medicine in medical school. The history of medicine is littered with these examples of, oh, this thing is psychiatric. Oh wait, our bad. We just discovered MRIs, that's a real thing. Epilepsy was considered psychiatric. I mean, so many things. And then even what I've seen in my semi-recent career as a physician, fibromyalgia. Oh, that's just a woman who's histrionic. Oh no, now we know that's a real thing. And I think that's something we do as integrative practitioners that conventional practitioners don't. And I couldn't do that if I were like burned out and hated my life. I also wouldn't have the space, and I wouldn't have the space for that, to like listen to them and take them seriously when every other clinician was just sick of them, if I was burned out seeing 30 patients a day. So yeah, I feel zero guilt. I don't know what else to say. Like, I feel zero guilt. So this was a question from Stephanie, who's not here, but let me answer it here and then she can watch it back. And basically, Stephanie had a question about social media, struggling with it, hired someone to do social media, it didn't go well, and she was wondering what she should do. And my questions were what went wrong, but also like what was the goal of being on social media? And your kind of answer to that was like, what, she wasn't really sure, just thought she needed a presence on social media. So in terms of marketing, you always want to make sure you're getting a return on your investment. And your investment is either money or time. With money, it's very easy to tell the return on investment. You spend X dollars and you make Y dollars, and is Y a couple multiples of X, then that's a good investment. Time, it gets a little bit fuzzier, and also when you're spending time, there's some learning in that that's valuable. Social media, it will, let me say almost never. I think never, but I'll say almost because maybe there's some extenuating circumstances, be useful for anyone here to pay someone else to do. If you don't know what outcome you want for it, then how does the other person even know what they should be doing and why you're doing it? And with social media, remember, social media is international. It's certainly not limited to the state or states where you're licensed. So if you're putting a bunch of time or money into social media, it's not a good marketing strategy. It's potentially a good sales strategy. And let me explain the difference. Marketing is making patients who are not aware that you exist aware that you exist. Social media can make people aware that you exist, but statistically, the likelihood that those people are in the state where you're licensed is going to be low. Sales is taking someone who already knows you exist and getting them to choose you as a provider. Social media can be useful for that because it's a place where you're essentially communicating, your value, your belief system, the way you treat, and someone who's, say, comes across your website and maybe has 4 websites of psychiatrists they're considering, maybe they'll check out your social media and they'll see something that would entice them and make them choose you as someone over someone else. The problem with social media though, Facebook, Instagram, TikTok, the problem with these is they are a vortex of content. They are not evergreen. You put something up, it disappears immediately. If no one saw it, no one's ever gonna see it. YouTube is evergreen. YouTube is like the next Google. It's used as a search engine. So if I were to go on social media, I mean, I am on social media, but if I were you deciding between what social media to invest in, it would absolutely be YouTube. If I were to say for all of you, what would be most useful from an advanced marketing strategy to do, forget Facebook, forget Instagram, forget TikTok. Maybe when you're making a ton of money, you hire someone with the very specific task of taking your long form content and making micro content, but then you focus on long form content. And that is blog posts and that's YouTube. So Instagram, micro content like short form, Facebook, Instagram, all that, rewards short attention spans. It rewards like clickbaity content, like I kept getting served up stuff of like animals in distress because one time I saw it and I was like, oh, this is horrible. And I watched it for 5 seconds and they keep showing me more things. It appeals to the lowest common denominator, whereas YouTube, the system optimizes for long watch times. It optimizes for around like 10 minutes, is probably 10 to 15 minutes the ideal YouTube video. That optimizes for an actual nuanced conversation, actually teaching something, providing someone real value, having a nuanced discussion like in an interview. And also because Google owns YouTube now, the two are very synergistic. If you embed a YouTube video into a blog post on your website, that blog post will be prioritized by Google's search engine. So if they type in integrative psychiatry, whatever your area, and you have a blog post with an embedded YouTube, that's going to be prioritized over someone who just has a blog post or just has a website. And if you're thinking about what the outcome is you're getting from that, again, it's really not marketing, because most of those patients who find you on Google are not going to be in your state of licensure, but it is helping you with sales, convincing patients to see you as opposed to someone else. So let me give a very specific example. I have an intake coming up next week of a patient who's traveling to see me from Alaska. There are people between Alaska and me who can see this person, right? Why is she coming to see me? Like, it's not like I'm doing anything so magical. Obviously, I'm differentiated, but it's not even like I'm more clinically skilled or something than everyone between Alaska and here. It's just I communicate more effectively on my website exactly what I do, and I'm more visible. I have certain SEO traffic and everything like that. This person coming from Alaska, you better believe she had like read all my blog posts. She basically came to me, she's like, yeah, I've already read your entire website. Let's just set up the appointment. That's what that does. There's zero sales on your calls with those patients. They've already made the decision, they already know your value, and they already want to see you, and it saves you a ton of time. And yes, it's a lot of work to write a blog post, to make a YouTube video, but you do it once and it lives forever, as opposed to Facebook, Instagram, all that, which it immediately disappears. So for Stephanie, what I would say is just forget about doing those short form stuff, at least for now. If you want to get into that advanced marketing stuff, write a blog post.